Hey, how have you been? Good. That's good to hear. Have you been doing anything new or exciting this year? Oh, that's great. That's awesome. I'm glad to hear that. So, according to my schedule, it appears that we have you here today for your annual physical, correct? Okay. Let me just pull your chart up really quickly here. Okay. So, looks good. Do you have any specific concerns you'd like to talk about or address today in your visit? Okay. Is that something that started recently? Okay, we'll take a look. Is your medication list current? Okay. Do you need any refills today? Okay, the gabapentin, yeah. Okay. And how has life been in general? For example, have you had any stressors, any new stress enter your life? Okay, yeah. How are you managing your stress? Okay. How are you sleeping? Are you sleeping through the night, waking up a bit? Okay. Do you know about, on average, how many hours of sleep you get a night? That's not bad. I would like to see you getting a full 7 or 8 hours, but that's something we can talk about. Okay. So, let me get some gloves on here. So you're saying that your scalp has been feeling pretty itchy and you've been noticing dandruff. Okay. Well, let's start there, okay? And we'll work from the top on down. So I'm going to stand so I can see. Are there particular areas that you're seeing? Okay. Yeah, I see that. I am seeing the dandruff, and it does appear to be yellowish in nature, which indicates to me the potential for it being fungal in nature. So I'm going to start off by prescribing for you a prescription dandruff medication that should help. Don't feel bad. As we age, it's actually pretty common, especially as hormones change, for our immune system to be affected and potentially diminished a little bit, especially at certain times of the month. And everybody has a cycle of some form. So, one of the places where we can see evidence of our immune system changing is actually on our scalp. But I'm not feeling any occipital lymph nodes here, so I'm not terribly worried about it. We'll just start you on a low dose ketoconazole shampoo, and that should help get this taken care of and managed. So, before I forget, okay, good. So now we're going to move down a little bit and check your eyes, okay? And the first thing I'd like to do is, you able to see my chart here? Okay. Can you read for me this line right there? Okay, good. Are you able to read anything here? How about here? Okay. This line? That's okay. Don't worry. And let's have you gaze directly ahead, okay? I'm going to be shining a little light in your eye, and I'm gonna try and make it quick so you're not too uncomfortable. And I just need to check and examine the vessels in your eye. Yep. Keep gazing ahead. Switch eyes now. Do you ever experience any kind of eye strain, ocular migraines? Okay. How about blurry vision? And do you ever have instances, particularly in the morning, where it's difficult to focus your eyes? Okay. Right. That's something that's pretty common as you get older. It tends tends to hit people about 40, where they wake up all of a sudden and their eyesight is not what they were used to. My pen light right here. Without turning your head, I'd just like you to follow it with your eyes, okay? Good. How was that? Did you feel like you had to strain? Okay. Okay. So now I'm going to take a listen to now I'm going to take a look at your ears. Sorry. Sometimes I think faster than my mouth can keep up. So, alright. Any tenderness or discomfort? Your ears look good. Not seeing any sign of redness or swelling inside of the ear canal. Your tympanic membrane is intact. I'm not seeing any scar tissue or perforation. A little bit of cerumen, which is earwax inside of the ear, but that's okay. As long as it's not impairing your ability to hear. Okay, good. Check the other ear now. Oops, sorry. Okay. How's this side? Any pain? Okay, good. This side looks good too. Nice and clear. No redness or inflammation that I can see. Tympanic membrane looks like it should. Not seeing any fluid or anything. So, okay. Let's take a look inside of your nostrils, okay? Alright. Good. Not seeing anything concerning there. Take a peek in your throat. tonsils look good. Not seeing any redness or anything indicative of any postnasal drip. I'm going to take the depressor out and I just want to take a look inside. Buccal mucosa is a nice normal pink. Can you lift up your tongue for me? Great. Close your mouth and relax. And take a look at the outsides of your ears, okay? So I'm just gonna kind of move your hair back here. I can see. That looks good. Check the other side here. There's a little bit of dry peeling skin here in the folds of the cartilage, which is a normal place to see it. It's common to have some oil imbalances because we produce a good amount of sebum around the ears. Sometimes that can cause some skin irritation. Can you swallow for me? Perfect. No lymph nodes and your thyroid looks good. So now, I'm going to take a listen to your chest. Can you take a deep breath in for me? And out. Good. Again, deep breath in. And out. Again. And again. Okay. So I'm going to have you lie back so that way I'm able to listen and examine your tummy, okay? Okay. So yeah, you can just breathe normally, that's okay. Tummy sounds good. I'm going to be pushing on your tummy a little bit. Let me know if any area is particularly tender. It's okay. Okay. Just going to reach around and feel your kidneys. Any tenderness here? Right. And if it's okay with you, I'd like to palpate just a little bit in your groin. I just need to feel for some inguinal nodes. I'm not going to be touching you outside of... Okay. Thank you. Okay. That's all I need to do there. So, alright. Can sit you back up. Now I'm going to take a look at your extremities, okay? So your arms and your legs. Looking for something called pitting edema, which is swelling and fluid retention, which I can tell just by pressing and seeing how long it takes for the skin to return to its normal color. I'm also going to be doing a reflex test, okay? Okay. Arms first. Do you ever experience like tingling or numbness in your fingers? Okay. How about your feet? Okay. Okay. Can you clench and flex your toes for me? Perfect, okay. We had a rogue tongue depressor. So, I'm going to test your reflexes now, okay? Don't worry, it's going to be gentle. Good. Excellent. Sometimes some of us have a side that can be a little bit sluggish. But it still reacted, which is what's important. Okay. Legs look good. Feet look good. All right. So then let me get out a sheet here. So, actually, I can take off my gloves now. We have a practice here where, as our patients are starting to get a little bit older, that we do cognitive testing. And the reason why we start so early is because we want to make sure that if anything might even hint at being a positive symptom, we're able to get ahead of it, okay? So don't let this scare you. I'm not seeing anything on your exam that's indicative to me of any kind of cognitive deficit. This is just customary for our practice. Okay. So I have this sheet here, and you'll see, sorry, my hand sometimes has a little bit of a tremor. You'll see there's a variety of objects. We have animals and 2 plants. I guess, oh no, mushroom. That's not a plant though. And a cucumber. So I'm going to ask you a few questions about the items on this sheet. Can you tell me, is this an object or an animal? Okay. Can you identify what this is? And the color? Good. How about this here? And the color? Good. Can you identify this for me? How about this? Animal or object? And animal or object? What color is this watering can? Good. And let's see. What is this object? Good. Okay. So actually put that right there. Nice high scores. Okay. So let's take care of this prescription. So, okay, I'm seeing that you have Medco listed as your pharmacy. Okay, that's where you want me to send this. Okay. just wanted to ask because if you are very close to being out, then I would suggest sending it somewhere where you could pick it up locally today. But if you still have about a week left, we should be fine. So that means 90-day supply. I'll give you 5 refills, and generic is fine. Okay. And that's the only prescription that you need. Okay. Okay. So then I'm going to be sending an order to the lab to have you have lab work done. It's just normal annual testing. Have you eaten today? Okay, that's fine. We're still going to check your cholesterol, but it's okay if it's not fasting, because looking at your numbers here, they've been in normal range. You had one incident of elevated triglycerides about 3 years ago, but since then it's been in a healthy range, so I'm not worried about that. The only one we'll have to see is a glucose test. So we'll see what they say to you in the lab. If you need to come back, then we might need you to come back. But usually it's not an issue. So okay, we'll do 7, CBC, lipids panel, and we'll add ICD-9 code B5869. It looks like next year we'll probably send you to have a colonoscopy, but we don't need to do that this year yet. It's standard. It's something that we like to keep track of, and we start here a little bit earlier than other clinics just because, again, we like to stay on top of things. Okay, so then we had talked earlier a little bit about your sleep hygiene, your sleep routine. So you're saying on average you're getting about 5 or 6 hours a night. Are you having a hard time falling asleep or staying asleep? A little bit of both, okay. Do you take any sleep supplements like melatonin, L-theanine, magnesium? Okay. No, I absolutely support using CBDs for sleep. But if you're still struggling to stay asleep at night, then you still need to address that. So can you tell me what your routine is before you go to sleep? Okay, so you are watching TV in bed and then scrolling your phone. It's really common these days. However, it can really interfere with our natural rhythms and our ability to stay asleep. If it's hard for you to let go of your phone, I definitely recommend putting it in night mode if that's an option. You have it? Okay, good. If you're going to watch TV, I recommend doing it in a different room, like your living room, rec room, den. So that way, when you go into your bedroom, you are establishing a routine that allows your brain to associate your bedroom, your bed, with sleep. It seems that when we watch TV in bed and then go to sleep, our brains kind of get locked into this routine of having this stimuli, and it's harder for us to make that association with the bedroom being just for sleep. So that can contribute, as well as just the blue lights and the stimuli from the TV itself. I actually recommend, if you're a reader, to read in bed. Using a Kindle is fine. I personally prefer being able to turn pages. Or sometimes people like to do some nighttime yoga. Cold shower, hot shower, depending on your preferences. For some people, cold can actually calm the parasympathetic nervous system, which can allow for easier sleep. But for some people, they find it invigorating, so you'll have to make that judgment call for yourself. Okay? And if you continue having a difficult time falling asleep and staying asleep, then we can schedule a sleep study for you and see if maybe something else is going on that we can address. Okay. So then, just... how has your mental health been? Okay. Are you having any bouts of anxiety, depression? How many days a week would you say that you feel anxious on average? Okay. Do you feel like that interferes with your life? Okay. If that starts getting more severe, more frequent, we can start talking about medication, or have you talked to one of our psychiatrists here at the hospital? I just want you to know that we do have a lot of resources for you available here, okay? Okay. Do you currently talk to a therapist? You do? Okay. I didn't see that in your chart. What is the name, if you don't mind? Oh, yeah, I know them. Okay, I got that in there. I won't be contacting them unless something became necessary or they needed to talk to me, but it's good for us to have all of your healthcare providers on record, just in case. Okay, so do you have any other concerns or anything that you'd like to talk about today? Okay, well then I think we are good here. So I sent lab orders to our lab. They should have them, and it would be great if you could get that done today, if you don't mind. Okay, you know where it is? Awesome. Okay, so go ahead and head over there. There's a little button you can push if nobody's there. It lets them know that somebody's waiting, and usually they're able to come out and get you within 5 minutes. We try to have a really quick turnaround time here at the hospital because we know that people have busy lives and they don't want to spend it all day here. Okay. Well, it was really nice to see you, and I'll see you again soon.